As Suicide Prevention Month kicks off today, we're taking another look at the state of mental health services across the Commonwealth. In Cumberland County, a $3.3 million budget deficit is threatening a rollback of vital mental health programs. Fox 43's Matt Kleinitz examines the extent of the problem and how it could affect people in need of those critical services.
It's a problem no mental health professional wants to hear.
We've invested our lives and our careers in helping people, and this is very counter to that.
Cumberland County officials are looking into rolling back some of its mental health services after the county's projected budget deficit hit $3.3 million. Annie Strite, the county's mental health administrator, says they are meeting with county providers to try and navigate this difficult situation.
We're doing our best not to hurt people. We're doing our best not to hurt the people we serve, as well as the providers that we contract with, so they don't have to lay off their staff.
Over the past 15 years, Cumberland County's mental health services have been operating on flat or decreased state and federal funding, all while the demand for services has gone up. The county has also spent nearly $2.3 million on top of what they got in state funding over the past 3 years.
A lot of those one-time funding resources are quickly drying up. The need is great, and we're not being able to fully address it.
This is a community problem, but it can also be a community-driven solution.
Louis Bianco works as a mental health professional and used Cumberland County's mental health resources in his battle with bipolar disorder. He says a loss of services could put more strain on those who are going through a crisis.
The idea that this could all go away at the same time would put us at risk of even more people experiencing stress or distress and requiring services.
The 2024 Pennsylvania state budget increases funding of county mental health resources by $20 million. However, Lisa Schaefer with the County Commissioners Association says that won't be enough to meet the demand for services.
It's just barely enough to keep the lights on at this point. You know, we had asked the state for an increase of about $250 million to really start to rebuild that system.
As state lawmakers return to session this fall, Schaefer is urging them to take more action to help those in need.
If we don't start making that serious investment now, we're going to continue to see the system deteriorate, and the people of Pennsylvania will suffer for it.
Matt Kleinitz, Fox 43 News.